We've seen a significant reduction in my dog's aggressive behavior since identifying comorbid health concerns. What that really means is that by identifying and treating these comorbid health issues, we've seen a decrease in her baseline stress levels and a decrease in the intensity of her stress responses. We've also seen an increase in her resilience to stress. We've seen a reduction in her perception of threat. And that makes sense on a lot of levels. Chronic pain is not dissimilar to chronic stress. Chronically, it can be a big factor in dysregulation. The quickest way to dysregulation is perception of threat. And when you don't feel well in your body, on top of being increasingly dysregulated and more sensitive to threat perception, you may also be more guarded about your physical space, have a smaller tolerance for distress, and your perception of your ability to move away from a stressful situation versus to move forward with aggression to make the threat move back may be compromised. So this video is an update about some big information that we found related to Amore's underlying health concerns that have a huge impact on her behavior. But let me catch you up in case you're not familiar. Amore is my 13-and-a-half-year-old dog. We've been together since she was 6 months old as a foster. She experienced a lot of trauma early on and has a diagnosis of generalized anxiety disorder. The primary way that this presents is through fear-based aggression toward humans. She also has some handling sensitivities and leash reactivity. I'm a certified dog behavior consultant specializing in nervous system dysregulation, and I have learned a lot over the 13 years that Amore and I have been together. Pain and physical health has been on my radar for a long time. Amore does have arthritis and a luxating patella. She's had a TPLO surgery to repair a cruciate ligament that was torn. We've been treating seasonal allergies for years, and we suspect that she has IVDD, unconfirmed. We know, of course, from the famous Mills 2020 meta-study looking at aggressive behavior and pain, that up to 80% of dogs displaying aggressive behavior have comorbid health issues directly or indirectly influencing their behavior, and that is certainly the case for Amore. We know that statistically, the most likely of that is orthopedic pain, as I've just mentioned for Amore. We know the second most likely is GI-related. Amore's musculoskeletal pain has been managed and continues to actively be managed for many years through medications, therapies, environmental changes, thoughtful exercise. Maybe a bit over a year ago now, I began to suspect that she was also having some GI issues. Acid reflux was at the top of my list. We did see a reduction in some of her symptoms by introducing a PPI. Long story short, she ended up being diagnosed last spring with chronic pancreatitis, confirmed, and with suspected IBD, not confirmed. Since treating for those conditions through medication, diet, supplements, we have seen another significant shift in all of the things I mentioned earlier. But there were still some unresolved symptoms. I could tell that things were still happening. Specifically, after her last IBD flare, her allergies, seemingly environmental allergies, were becoming more challenging to manage, and there were some lingering GI symptoms that I didn't love. We went to internal medicine, and there were so many options. Now, it should be noted, this kid has had multiple GI panels, multiple CBCs, multiple ultrasounds this year alone. None of what we discovered, except maybe the luxating patella back when she was much younger, were identified on just like regular blood work and a physical exam. This has been the culmination of years of investigating with multiple vets and specialists collaborating with each other, with behavior fluctuations being the primary symptoms. And still, it was years into likely having these conditions when symptoms finally hit a clinical level that we were actually able to dig in deep to what was going on. But she was struggling with these things. These things were influencing her behavior for a long time before they hit that level. And it was not for lack of searching. But it took a while to pivot from orthopedic to GI and allergies. So I won't keep you waiting any longer. Amore has been identified to have a mast cell tumor, likely low, and we are going to move forward with surgery, and the prognosis is looking pretty good at this point. This explains some of the allergy worsening and inability to control it with what had been working. And guess what? This also explains the remaining GI symptoms. And I'm sharing this with you for a few reasons. One, I cannot stress enough how important it is to investigate comorbid physical causes with our dogs with behavior concerns. It is absolutely not enough to just say nothing showed up on the basic exam and blood work. Think of a time that you have been feeling unwell, but that it was not obvious from the outside. Maybe you were feeling really unwell, but you didn't have any obvious wounds. You weren't actively seizing. You weren't projectile vomiting on the doctor, but you felt really like garbage. Imagine a time when that has been true. If you went in and didn't relay any of your symptoms about how you were feeling internally, in ways that could not be seen externally to your doctor, how much more challenging in these situations would it be for them to figure out what was going on just by giving you an exam and doing your blood work? How often do people go to the doctor feeling like absolute garbage in a way that is disabling them and wrecking their life, and the test results come back fine? This is the same type of thing. The behavior is the symptom. That does not mean that those dogs don't also need behavior therapy. And I think sometimes that is a misunderstanding, that we have to somehow rule out physical health issues, and then if there's anything left, we do behavior therapy, and that is not how it works. Amore still has an anxiety disorder. She still has experienced a lot of trauma. She still has been living with chronic pain, which in itself is dysregulating. She still has created negative associations and learned things about what is important to her survival that are not necessarily reflective of the environment she is in now. It is still imperative that her environment and her relationships are set up to help her feel safe. The work of behavior therapy is still incredibly relevant here. The other reason I share this is because taking a holistic approach is so important, right? We've got orthopedic stuff. We've got allergies, dermatological stuff. We've got gastrointestinal stuff. Now we've got cancer. And this has been an ever-evolving process. It's taken a lot of investigation. It hasn't been a single answer or a single diagnostic or even a single veterinarian. And that has been true with a behavior consultant as her human and a really incredible team of very intelligent, very collaborative, very curious veterinarians. Our team is impeccable. And not everyone has that type of team. And not all pet parents have an understanding of just how likely it is that behavior concerns are comorbid with physical health concerns. This is one of the biggest things I struggle to convince a lot of my clients of. Sometimes it isn't until years after we have worked together that I get, a little update letting me know how the dog is doing. And we find that they have a chronic health condition that they have likely had for a really long time that finally hit clinical levels where we were able to see it more overtly, more obviously. It is a pattern I see all the time. And I so wish that it was more common knowledge among pet parents and pet professionals. So anyway, that's my update on Amore. Fingers crossed, it seems like this really could be the missing piece of information. My best hope is that this resolves the allergies that had become not completely managed and the remaining GI issues.